Let's start with the section 1 of our lecture, Antenatal Obstetric Complications. And in this section, we will talk about musculoskeletal problems. Different problems which we will talk about in this section is backache, symphysis pubis dysfunction, and carpal tunnel syndrome. First, let's talk about the backache. The backache in the antenatal period, especially as the uterus grows and abdomen becomes bigger and bigger, because of the pressure of growing uterus or the growing baby on the spinal column, cause lower abdominal pain. So backaches are very common, especially in the late pregnancy when the uterus is grown and the baby is getting bigger. And there is also exaggerated lumbar lordosis. The backache is usually in the lower back. This is the lumbar region. Our vertebral column is divided into 5 sections. We have cervical vertebrae, then thoracic vertebrae. Below that is the lumbar region. So this lumbar region is lumbar lordosis, is the inner exaggerated inward curve of the spine. So that is a reason for the backache during the antenatal period. Then causes of low back, especially associated with in the pregnancy or in the especially in the last trimester of pregnancy, there is changes in the hormones that occur during pregnancy that cause relaxation of spinal ligaments. So relaxation of spinal ligaments causes the muscles and the ligaments that holds the different structures together, they are become loose and they become more painful. And then there is another reason is there is shifting in the center of gravity as the uterus grows. So center of gravity is changed with growing uterus that can cause low backache. So low backaches, different reasons: relaxation of the ligaments because of the changes in hormone, shifting in the center of gravity, and there is exaggerated lumbar lordosis. All these factors, there is pressure on the nerves also because of lumbar lordosis, and it can cause backache. So backache, this is the region that's involved, mainly lumbar region, and it's very common in pregnancy. Then the symphysis pubis dysfunction. This region is known as the symphysis pubis, where the 2 pubic bones of the hip bone of the right and hip bone of the left side, where the pubic bone come and unite together. This is the region known as the symphysis pubis. This is the pubic bone, this is the symphysis pubis. Different ligaments, different muscles are attached there to the pubic bone here, you can see. So this middle portion, very important landmark during the in obstetrics. Once the head of the baby is out of this area, then it means it's very easy now. It can be delivered normally vaginally. So pubic symphysis is the important landmark in obstetrics. So dysfunction is common in 3rd trimester. Pregnancy is divided into 3 trimesters, each of 3 months. So in the 3rd trimester, it's very common because now the uterus is big, baby is growing, and increased pressure on all these areas leads to symphysis pubic dysfunction. So it's common in 3rd trimester of pregnancy, and the joint become loose. So the ligaments, stretching of the ligaments, pressure on the ligaments, pressure on different structures cause the loosening of the joint. This is symphysis pubic, and there is loosening of this joint. As a result of this loosening, the two pubic bones, they rub with each other, and walking becomes very uncomfortable too. So it causes problem in the walking. So the pubic bones, they rub on one another when walking or moving. So this is due to symphysis pubic dysfunction due to relaxation of the ligaments, and relaxation of the ligaments as a result of the pressure of the gravid uterus or enlarged uterus. These ligaments become loose, and loosening of the ligaments cause loosening of the joint, and there is rubbing of the bones on top of each other when walking or moving. So this is symphysis pubic dysfunction. The other important musculoskeletal disorder that's common in pregnancy is carpal tunnel syndrome. Other factors can lead to carpal tunnel syndromes, but pregnancy can lead to carpal tunnel syndrome as a result of fluid retention, as a result of swelling or edema. That's the main reason in the pregnancy that can cause carpal tunnel syndrome. If you see in this diagram, this is the carpal tunnel, and beneath this carpal tunnel there is median nerve is present. This is the median nerve, which is the major nerve that supply the muscles of the hand also. So when there is compression of this median nerve as a result of carpal tunnel syndrome, there is tingling and weakness in the hand, and it's a very, very bad, painful condition. So median nerve, major nerve that carry message between the hand and the brain. If the compression of the nerve occurs, messages are not transmitted well, and this can lead to different features like numbness of the hand, tingling, weakness of the thumb and forefinger. So in this condition, when it becomes very bad, usually it's very hard to hold the objects in the hand. Even doing simple work like using the knife to cut things, holding fork, it becomes very, very painful. There is numbness of the hand. You cannot grasp anything with the hand. There is tingling and weakness of the muscle. Different conditions can lead to carpal tunnel syndrome, and the most important is if you see here, there are mainly due to swelling and edema and different conditions like doing the handwork, repeated the same task when performed, other conditions like weight gain, diabetes, and doing the multiple tasks with the hand, all these can cause carpal tunnel syndrome. So mainly it's due to involvement of the median nerve. If there is swelling, it's a tight area, and the sides and the floor of the carpal tunnel is made up of the carpal bones. Carpal bones are the bones of the small bones of the hand. So the floor and the sides of the carpal tunnel is made up of the carpal bones, and the roof is made up of this sheath, the sheath of the hand, and this median nerve crosses beneath that sheath. So when there is swelling, because of the rigid space, because of the boundaries made up of the carpal bone, this place does not have ability to expand. So as a result of pressure on the median nerve, the carpal tunnel syndrome occurs, and there is numbness, tingling, and weakness of the thumb and fingers. So these were some common musculoskeletal disorders that can occur in the antenatal period, in which we have backache, very common. Then we have pubic symphysis dysfunction, and then the third very common disorder is the carpal tunnel syndrome. Thank you for watching sqadia.com.